Hi, welcome to Chapter 4 of the Platinum Planner Preceptor Training Program. In this program, we're going to talk about three objectives. They are applying the components of active listening as well as effective communication transmission, speak on good rapport with the clinical student, and facilitating the clinical student in developing a good rapport with everyone they encounter in the clinical setting. Communication is one of our key aspects in everyday living as well as professionally. So being able to communicate well is critical. Part of the criticality of effectively communicating is active listening. Seek first to understand, then to be understood. So what is active listening? Basically, listening for understanding versus just for hearing the person. In listening, in that case, I want to ask clarifying questions. I don't want to ask challenging questions. I want to ask, did you mean to say this? To see if that's truly what they meant to say. I might restate to check for understanding. So what I understand that you said was, and then restating what they said in your own words, and then allowing that person to say, yes, that's what I meant, or no, that is not what I meant. So that's the active listening aspect. Also, anytime we're doing this, communicating back and forth, we want to make sure that the atmosphere is positive. We're not listening to interrogate. We're not listening to challenge or threaten. It's open communications. It's a positive atmosphere. So part of that open communication is to make sure our body language expresses that open aspect. So a closed stance, your arms crossed, your back to them, would all indicate a less than positive atmosphere. So we want our arms at our sides. We want to maintain good eye contact. When we speak, we want to be clear and honest. And again, we want to check for understanding. Did you understand what I said? Am I understanding what you're saying? We also want to develop a good rapport with our students. One of the key parts of developing that good rapport will be to have a positive learning environment. A safe environment, basically, is what you're saying. So you want to greet them with a smile and a handshake. Hi, welcome to the emergency department. Hi, welcome to EMS Squad X. You want to show interest in them and their learning needs. So you're here today. What level are you? What do you hope to learn today? What would you like to focus on? See if they have any concerns about their shift. Hi, is there anything that makes you nervous about today? Is there anything that you have some trepidation about? And also make expectations clear. If people know what their parameters are, what their limits are, they tend to function more safely because they know where's the fence. And create a safe environment to not know something. Remember, these are students. It's okay for them not to know things. Even as providers, it's okay for us to not know things. So it's a safe environment for the student to not know the answer to something. And part of the way you indicate that is it's safe for you to not know something either. Both of you can then go forth and research. In your interactions then in this developing good rapport, make sure that you're honest. If you don't know something, don't try to BS it. Just say, I don't know. Model appropriate behaviors, both with the student as well as with everybody else that we interact with. Train with empathy and compassion. Remember how you felt as you went through this. And though your experience may not have been positive, you may have said, I'll never do this to anyone else, then make sure that's not done to anyone else. Reinforce that positive behavior. When they do something right, catch them being good and say, great job. If they do something less than right, then correct them. But again, in an honest, positive fashion. Be open and avoid any dark humor. If a student hears dark humor, they think it's okay for them to say dark humor, and it rarely ever comes across properly from the student. Our third objective was to facilitate a good rapport with everyone else. The best way to facilitate the student learning a good rapport with others is to model that behavior. Model what that good rapport is with everyone else that we encounter. Patients, other folks in the medical community, other folks, say, in law enforcement, fire, etc. Explain their roles. This is what this person's role is in the system of healthcare. There are no justas. There's no just a first responder or just a nurse or just a tech. Everyone plays a key role. Manage the environment. So peer comments. So if a peer makes a deriding comment about a other staff member, at least say to the student later that wasn't appropriate. Positive reinforcement, constructive feedback. Teach that empathy and respect. Again, the best way to teach empathy and respect is to model that behavior. So again, in communications, we spoke about active listening, listening for understanding, basically, effective communication transmission, being open and honest. We talked about developing a good rapport, items necessary for that, positive learning environment, and positive interaction, and then a good rapport with others, and we spoke there about the most important aspect, which is modeling that good behavior. This concludes Chapter 4.